Okay. Hello, my name is Hamsika Thumu. I'm a member of She Votes Illinois board. I'm currently on their policy team and I'm here helping to create the Menstrual Equity Awareness Week that we have here. And to start it off, we wanted to interview Dr. Jana Richards to tell us a little bit about periods and what is normal, what is not, and to advocate for periods and teach teens about menstrual health. And so we created this a menstrual equity week alongside Northwestern's menstrual equity advocates, and we wanted to talk about periods. So, Dr. Richards, if you'd be able to introduce yourself quickly, and then we can get into the questions.
Good evening. I'm Dr. Richards. I'm an obstetrician gynecologist. I practice as a generalist at the University of Chicago. I am a native Chicagoan and I live in Hyde Park.
That's great to hear. I'm excited to interview you. So first off, I wanted to ask you, what are some things about periods that you wish more teens understood?
It's a natural part of life for most people. I do understand that there's certain people who may not want to have periods, and I can understand reasons why. But it is a natural part of life, and it should be something that may cause a little bit of interference or changes that you have to go through every month. But it certainly shouldn't be something that impedes a nice quality of life.
So going into kind of like how you were saying that it shouldn't impede your quality of life. So what is considered a normal period for teens and what's not?
So it's important to understand that when you first start having your periods, like the first 2 years, you probably are having periods where you're not ovulating. And
Mhm.
when we say ovulation, what we mean is, or people have to understand that the whole purpose of having a period is so that you have one egg that gets released every month. And that's really a complex process that sort of works between your brain, your ovaries, and your uterus. And if any parts of that system are affected, then you may not have normal or regular periods. And in the first 2 years, your menstrual regularity isn't the same as it eventually becomes as you age or as you get older. So, in the beginning, you may not have a cycle every month, and that is very common and very normal for somebody in their first year after they first start having periods, to not have a cycle every month. But eventually, and for most people, once they reach the age 18 and kind of between age 18 and 45, most people have some or have established some type of regularity, which means that they're going to have a period usually every 28 days. That is not perfect for everyone. And in fact, most people do not have a period exactly every 28 days. There's some variation in that. And that variation for most people is somewhere between 5 to 9 days. So if we're going to say that the first day of your cycle is the first day that you actually bleed, in terms of frequency, for most people, the next time that they're going to bleed again is going to be somewhere around 28 to 34 days. However, we don't say that it's abnormal or there's something that's wrong or we need to change things or give you a medication or try to help you. For most people, that period can vary from anywhere from 21 days to about 45 days. And we still can call that normal for a particular person.
Mm.
Next thing we think about besides frequency is duration. So, how long is your period? Most people have a period that lasts about 5 days. We don't call it abnormal unless you have bleeding probably past 7 days. And some people have a period that only lasts 2 to 3 days, and that also can be very typical. The hardest part to talk about is volume or how much is normal bleeding because that really is something that changes for everybody. It's also something that's very hard to quantify because most people bleed into a pad. So you don't actually get to see exactly how much bleeding that you have. For research purposes, if we had to say, well, how much is normal blood loss, we would say that's like 80 milliliters. However, 80 milliliters is probably something like a third of a cup or 5 tablespoons. And that's really hard to quantify in terms of blood loss. So we say that bleeding becomes abnormal when someone feels like their quality of life is affected as a result of how much bleeding they're having. Most people don't have to wake up in the middle of the night to change their pad. And if they do, that can sometimes signal that there's some heavy or heavier than usual bleeding going on. Most people don't go through more than 21 pads or tampons within one cycle. If that happens, then we'll say, well, maybe the bleeding is a little heavier than it should be. But if it really affects your quality of life, you don't want to go outside, you don't want to go to a party, you don't want to wear white pants, you're afraid of your outfit because you know that you bleed so heavy that it sometimes soaks through your outfit, no matter how often you change your pad or whether you're wearing a heavier pad, then that probably means that the bleeding is pretty heavy or abnormal.
Okay. So what kinds of symptoms would you say are also like abnormal symptoms, like when you have your period?
So I want to start with what's normal first. It is normal for a person to have what we call PMS or premenstrual syndrome. This usually happens about a week before your period starts or a few days before your period starts. And usually after your period starts, things start to get better, certainly after the first 1 or 2 days of your period. And that would be bloating. You might have a little bit of fatigue. You may have some cramping. You also may have a little bit of spotting that you see, but not real heavy bleeding. You may have increase in terms of cravings.
Mm.
Um, you may have a headache, and you may have a little bit of a mood swing or a little bit of irritability. And usually, once you start your cycle, things typically get better. That's very different from premenstrual dysphoric disorder. That's where you probably have all the symptoms I described before, but you may have the symptoms where the cramping is really painful and uncomfortable, to the point of, you may be taking Motrin or ibuprofen, or you might be taking Tylenol, but the pain is really disrupting your normal events. You may say if you run track, you can't go to your track meet, or if you play basketball, you can't play basketball. You notice that you're very, very fatigued. It's very hard for you to get out of bed. You may have mood swings where you feel very depressed. You have trouble with sleeping. You may also have bloating that becomes very uncomfortable for you. You may have intense cravings. You may not even want to eat. You may be very tearful and you just feel like you have a hard time, like this is actually affecting your quality of life. You don't want to go out. You don't want to go to school. You don't want to go to work. I think that would be when we would say the symptoms are abnormal, and we probably need to perhaps help you with these symptoms.
Okay. That's really helpful. So, kind of going into how these like symptoms can affect specifically teen athletes, how can the menstrual cycle affect teen athlete performance, and what should they know to stay healthy and active?
So, as I spoke about, it's very important to understand that your cycle is controlled by a complex feedback system. And that feedback system is between the brain, the ovaries, which tell the uterus to bleed. And of course, the bleeding comes through the vagina. And so, if you are an athlete and you are someone who is not getting enough energy, meaning you're not taking in enough calories or you're over exercising, you may not have a period. So, like people who are, let's say, if you were training to be a Navy SEAL in the Marines, or you are a gymnast and you're in the Olympics, you may not have a period because you may not have enough calories or enough body fat, I should say, to have a cycle every month. It doesn't mean it's necessarily a bad thing, but when people don't have a cycle every month, we do need to rule out some other things it could be. And if we find that there are no other things that it could be, then it's possibly okay for you not to have a cycle. What people have to understand is if you're not having a cycle, that probably also means that you're not ovulating. So as long as you're not trying to get pregnant, you're not concerned about pregnancy, it probably is an okay thing. But definitely, you do have to have a certain amount of body fat to be able to have a period. Now, the flip side to that, and that might not always be as a result of being an athlete, but you also have to balance that because if you have something called polycystic ovarian syndrome, That is a metabolic disorder. So that has everything to do with your energy intake. And 20% of people with polycystic ovarian syndrome are actually thin, but the
Mhm.
other 80% are typically overweight. And we recommend that if you lose just 5% of your weight or 10%, then you probably will go on and have normal cycles. Um, Adipose tissue makes estrogen. And so what happens when people have polycystic ovarian syndrome, they have multiple follicles in their ovaries and they don't produce a dominant follicle. And you produce a dominant follicle when you ovulate. And so they don't ovulate. So when people don't ovulate, they don't have a period. Now, when people have polycystic ovarian syndrome, they can still get pregnant because you don't ovulate every month, but you still ovulate sometimes because you still do get a period. So sometimes, if they just lose about 5% of their body fat, they have lifestyle modification in terms of their diet and what they're eating, then they may go on and have normal periods every month. You don't have to have a period every month. If you skip a month, that is okay. But we don't really want people going more than 3 to 4 months,
Mhm.
certainly not up to 6 months. And some people who have polycystic ovarian syndrome, they don't have periods. They'll tell you, I don't have a period except for maybe once or twice a year. Long term, that can cause a lot of problems because what you can develop is something called endometrial hyperplasia or endometrial thickening. And when you do this for about 10 or 15 years, you're at increased risk for endometrial cancer. So we do want people to have a period probably about every 2 to 3 months. And we can help you to have that one, like we talked about the lifestyle modification. If that doesn't work or that's very difficult, for you to lose weight, then we perhaps could give you progesterone and withdraw it, or give you an IUD, or give you something to keep the lining of your uterus very thin to prevent you from getting endometrial hyperplasia, which
Yeah.
is a precursor to endometrial cancer. And that's not something that happens to teens, but it certainly is something where I'll hear a teen or a person say, well, I never had regular periods. I started having periods when I was about 14, but I never had them monthly. I never had a cycle that I knew was regular. And I would have a period maybe every 2 to 3 months. And now, as time has gone on, it's actually worse. I might get a period once every 6 months. Then those are some people who may have PCOS. And so we want them to really understand it's a metabolic disorder. They're at increased risk for high blood pressure, diabetes. Um, they are also at increased risk for high cholesterol. So we do want to make sure we're monitoring those things.
Okay. So going back to specifically, going back to more inclusive care to talk about how athletes and students can get care if they believe that they don't have like a regular period, they're seeing some not normal symptoms.
Mhm.
So what can they do to talk to like how can they talk to their doctor about their periods?
So I think it's actually important. Certainly, you can always go to a pediatrician. Pediatricians definitely have this conversation with their patients all the time about your cycle. In fact, it's a question that they're going to ask. I think it's also important that you on your own know yourself better than anybody else. And so now, many patients have all of these apps. When I was in high school a long time ago, we just had a regular 30-day calendar, and we would tell patients, or I would mark on my calendar the first day that I had a bleed. If it was spotting, I would put an S. If it was heavy, I would put an H. And I would actually visually look at what is going on in terms of my cycle. I think it's important to start there. And if you notice that you have a pattern of irregularity, or your cycle's not coming, or you're bleeding in between, then it's time for you to reach out to perhaps your pediatrician. You can also reach out to an obstetrician gynecologist. It's important for teenagers to understand that you don't have to have a referral to come and see an obstetrician gynecologist. You can come like you go to any of your primary care doctors, like your pediatrician. And there's certain things that I cannot talk to your parents about. your parents can never call me and ask me for results if you came in and you got tested for sexually transmitted infections, or if you came in and you were pregnant. I can never release that information to your parents. Now, I can talk to them about you not having a regular period. That is something that they can ask me about, and I can give them that information. But I can never give them information about pregnancy, or if you have any sexually transmitted infections, or talk to them about, your sexual activity or things like that. Or if you're on birth control. Those are things I do not have to disclose to your parents. But you can also go to your pediatrician, and I would say you certainly can start there.
So again, going along with that starting point, so when is it important for students to talk to a doctor about their period?
When is it important, or
Yeah, when is it important? So,
uh-huh. So one is, and like I say, most students hopefully have access to a pediatrician. Yeah, I think it's important if you're not having a period. Now, pediatricians typically, you're going to have an annual visit with the pediatrician, and they're going to ask you have you gotten your period, right? Certainly by age 15, if someone doesn't get their period, that's typically considered abnormal. And so definitely there should be testing if you haven't gotten a period by age 15. But every year, your pediatrician is definitely going to ask you questions about your period. Now, you went to the pediatrician in September, everything was fine. You told the pediatrician, yes, I'm having a period every month. I'm having it 5 days. I don't have a lot of pain. It's not debilitating for me. I'm able to play sports. I'm able to go to school. I'm able to work when I have my period. That was in September. However, I left the pediatrician and I haven't had a period. Everything was fine, but I haven't had a period, and now we're in December. And the most common reason for someone who has started having periods for at least 2 years, they have menstrual regularity, and they do not get a period, the most common reason, or the first thing we think of is there any way that you could be pregnant? And if there's any way that you could be pregnant, I think it's very important that you reach out to someone. It could be someone at your school, it could be a counselor. You could go buy an over the counter pregnancy test. You could always, like I say, make an appointment with an obstetrician gynecologist. If you live in Chicago or the Chicagoland area, there are many Planned Parenthoods. These are places where you can just go and get a pregnancy test. No one's going to judge you. No one's going to make you feel uncomfortable. I think it is always important to rule that out because that is the most common reason. However, there's no way you could be pregnant, you're not even sexually active, then I would say then it's time to probably make an appointment, maybe tell your parents, or if you don't feel comfortable with that, make an appointment with a pediatrician or an obstetrician gynecologist.
so now talking about more inclusive care,
Mhm.
I wanted to ask, how can specifically trans teens who menstruate find respectful, supportive care, and what should they expect from a provider?
hmm So it's not easy, and I understand that. And I know that everybody doesn't live in a big city like Chicago, where you have special clinics, where there are doctors that are trained to help patients who are gender diverse and who feel very uncomfortable having a period. However, I think it is always a conversation. Like I say, once again, you can bring up with your pediatrician, or you can bring this up with your obstetrician gynecologist. And if possible, you certainly can bring this up with your parents. And there are many things that we can do, pretty much no matter what your age is, until you can get the gender affirming care that you're looking for or that you want. There are things we can do to help you not have a period. For many people, especially gender diverse patients, we do understand that having a period can actually cause major dysphoria. I mean, it can cause a lot of problems. And so there are many things we could do. One is there's a pill, we call it the mini pill, or norethindrone acetate. That's a pill that we can give you that you pretty much take continuously. It's progesterone only. If you take progesterone continuously, you're not going to have a cycle. Um, Sometimes you'll get some breakthrough bleeding or spotting, but if you continuously take progesterone, you're not going to bleed. And that is why most typical birth control pills actually have estrogen and progesterone in them. It's when you take the blank pills or you take the pills that don't have any progesterone, that's when you have a period, because naturally progesterone levels have to go down. They go down if you do not conceive or you don't get pregnant. And then that's when you bleed. So progesterone levels are very low at like near the first day of the cycle or when you start bleeding. So if I give you progesterone continuously, either in the form of a pill or a Depo-Provera injection or a Depo shot, as most people talk about, typically, certainly once you get the second shot, which is after 12 weeks, most people do not bleed at all. We also have a Mirena IUD. Now, that is not something that is comfortable for everyone. Certainly, if you're going through gender affirming care, you may not even want to have, you may not even want to say that you have a uterus, let alone someone place a device in your uterus. So, that's not something that you always might want, but it is something that could be placed that could possibly also keep you from having a menstrual cycle
Okay.
or menstrual bleed, I should say.
Yeah. So when students or teens are looking to they're experiencing well, not normal symptoms and they're looking for care, what are some things that they can expect from their doctors when they go to their doctors and say, "Hey, this is what I'm experiencing. This is not normal. These symptoms, they're very debilitating. They're not allowing me to like live my normal life. What are some things that they can expect from their doctor?"
So the doctor's going to run some tests. That is definitely be expected. And like I say, test number one is going to be a pregnancy test. Hopefully, you don't find that offensive. We as obstetricians understand, or as a pediatrician or doctors understand, everyone may not feel comfortable telling us if they are sexually active or not. But that's the one thing we can sort of certainly rule out for a reason for not having a period. We also are going to check some other hormones. You could have something that is wrong with your thyroid gland. Your thyroid gland sits, right here in your neck. It can definitely have an effect on your periods. If you have hyperthyroidism, meaning your thyroid overreacts, or you have hypothyroidism, where your thyroid is not acting in a way that it can, the hormones that tell your thyroid how to respond, they live in the brain, and they live in the same place in the brain as the hormones that tell your ovaries to tell your uterus to bleed or not. And so definitely we would run tests to see if there's something going on with your thyroid. We would look for signs, because when people have polycystic ovarian syndrome, they can have darkening on the back of their neck, they can have darkening under their arms, they may have acne, they may have hair in places that people who identify as female or don't identify as female, but people who were assigned female at birth, they may have a hair on their chin, they may have a mustache, they may have hair on their cheeks, they may have hair on their thighs, they may have hair in places that they didn't have before, or aren't places where women or female patients have hair. And so we're looking for those things. We're looking to see, do you have breast development? Do you have pubic hair development? Because we haven't even talked about people who have certain disease processes where they're not even going to get a period. Someone who has Turner syndrome, meaning they have ovaries that pretty much don't function. Well, they're not going to get periods, probably, unless we give them hormones to make them have periods. And so we're looking for signs. Does a person have Turner syndrome? And we're also looking for signs that you've gone through puberty. So we may ask to, if it's okay to examine your breast or to look for pubic hair, or ask you questions about those things. And we may check other hormones too. We may actually check your estrogen function. A very cheap way that doesn't require a lot of testing to see, especially if someone comes to us and they say they're 15 years old and they never had a period, or they had periods and then they stopped and they haven't had a period for a year, we'll give them progesterone.
Mhm.
We'll tell you to take it for 10 days, and then we'll say stop taking it. And so if you have an intact uterus, you have intact ovaries, you have not gone through menopause, then you should get a period when you withdraw the progesterone. So that's another thing that we might do to see if or why you're not having periods.
All right. So now I wanted to go into a little bit of myth busting. And so I wanted to, oh,
Let me say one more thing before you go into myth busting. I'm sorry, I should have said this. What I think is important, and I know I was a teenager. I am a person who has had many changes in my cycle. I'm now of age where I probably am postmenopausal. I don't have periods because I have a Mirena IUD, which I've had probably for the last 10 years. There's a lot of shame, there's a lot of guilt, there's a lot of embarrassment, and I think we probably will go through a lot of that with the myths. But I do think it is important for you to understand that most of the time when you seek a healthcare provider, um, we're not going to judge you. And we are going to try to help walk you through the process of why you're not getting a period. And a lot of times, the first thing that comes to mind, especially when patients don't get a period, is they think, does this mean I'm not going to be able to get pregnant in the future? What does this mean in terms of fertility? Even if they know they don't want to get pregnant at 16 or 17, they're always thinking about, well, what does this mean for my future? And just know that there's so many things that we can do, and very often most people, their cycle will regulate if we can correct or fix some other underlying causes that might be a reason for them not to have a period. So there really is no reason for you to have guilt or shame.
yeah, that's a really important remark. So now we can go into the myth busting unless there's anything else that you would like to add.
Mm-mm.
Okay, and so we wanted to discuss some common period myths, just to dispel them because there's a lot of misinformation that goes around about periods. And so the first one I wanted to talk about was that severe cramps are just a part of having a period.
Yes. So, like I said before, we do know that most people have some premenstrual syndromes and symptoms, and some people do have cramps during their period. However, the cramps should not be debilitating. Periods should never be something that makes you unable to eat, makes you unable to sleep, makes you not want to attend to your normal activities. Um, and so, if you have cramps so bad that you throw up, or you have cramps so bad that you can't function, you feel like you just have to, that day you have to take off, you have to stay at home. There are certainly things that we can do to fix that. That is not normal, and periods are definitely not something that you should feel like you have to suffer through. We have many different things that we can do to try to help you not have painful periods.
Okay, that's really important to know. So the other common myth is that you can't get pregnant on your period.
So technically, if we're saying on your period, meaning days 1 through 5, the days that you actually bleed, if you were to have intercourse on those days, you probably cannot get pregnant. And that probably is not a myth. The problem is if you're somebody that does not have menstrual regularity and you're bleeding and you think that you're on your period and you're not on your period, um, and you go months and you don't have a period, especially patients, like I say, who have PCOS, they have to be very careful because they're not able to figure out when they're ovulating. That's a very hard thing for them. And so perhaps what you thought was a period wasn't a period. And you end up pregnant, even though you had a little bit of bleeding, for the few days during the month. But usually, um, in the beginning of a cycle, because cycle day one is when you actually bleed, you really can't get pregnant during those days. You normally get pregnant around the time of ovulation, which typically happens, if you're talking about somebody who has a 28-day cycle, that happens around day 14, so about 2 weeks after you saw the bleeding.
Okay. Another common myth is that PMS is just moodiness and just kind of things that you just have to deal with.
Right. And so, like we talked about before, you do not have to deal with anything. A period is not punishment, a period is not an excuse for being angry. It is not an excuse for you being in so much pain that you throw up or you're so sick. Those are things that we definitely can help you work through. And I think the other important part about all these myths is everybody doesn't experience the same thing when they're on their periods.
Mhm.
Everybody doesn't have bloating. Everybody doesn't have mood swings. Everybody doesn't have real heavy bleeding. We talked about the volume of blood loss. Everybody, for everyone, that is very different. And so, I hear people say all the time, "Oh, are you on your period?" Because you're speaking up for yourself, or because you're saying no, or you're not people pleasing. And I find that actually offensive because um I don't think that everyone has certain mood swings where you can tell, oh, she's bleeding or she's on her period. I don't think that happens all the time to everyone. I do know that, like I said, there are people who definitely have dysphoria, and they definitely have that, perhaps a week or 2 weeks prior to their period. And then when they get their period, the symptoms get better. That is true. But that is not something that happens to everybody. And we definitely can help you with that.
Okay. I think that's a really important note for everyone in general, that it's just not supposed to be so like painful, and it's just a part of life,
Mhm.
and that it should not be this thing to be excused
But
or
dread,
ashamed for.
dread. Yeah.
Yeah.
I
Um,
did want to say about the depression or dysphoria that people certainly can have, either the first few days of their period or a week or two before their period. I think that is definitely something, if you notice a pattern. And the same thing, like I spoke about how you journal or you make a calendar, you write about what's going on the 2 weeks leading up to your period. If you do find yourself very depressed, or you find yourself very fatigued, or you do notice your emotions are really affecting your quality of life, then it is okay to bring that up to a pediatrician or to an obstetrician. And definitely, some people, we put them on antidepressants, or we put them on medication that helps them with their mood changes that they have during their cycle. That is not unusual, and that is something that we find all the time. We don't have to fix everything with medication. You certainly can try some meditative practices. You can try slowing down. We know that when people are very anxious or people are very stressed out, meaning you have an exam coming up, or you're always, like you say, very active and you're exercising, you have things that make you very stressed out, then there's some things that perhaps we need to do to try to help you relax. And there's some things you can try to do to help relax, and that may help you with the emotional changes that you might have throughout your cycle, or the pain or cramping that you might have throughout your cycle.
well, thank you so much. Those are all the questions that I had for you. So if there's anything else that you wanted to talk about, feel free to say anything.
No, I think that's it. I'm so glad that I was able to have this conversation. I think that the more that we can understand about ourselves, the more that we can understand what's natural, what's not natural, why we even have periods, I think the better we will be. But I also think it's important that patients who are assigned female at birth understand that. You don't have to suffer through your periods.
Mhm.
There are things that we can do to help you through the process, and it certainly shouldn't mean that you are not enjoying your quality of life. If it's 5 days out of the month, or 3 days out of the month, there are things that we definitely can do where you don't have to dread your period.
Yeah. Thank you so much for doing this interview with us and taking your time to talk with us today. I think it was really important to share this information, especially for teens, that can sometimes be really, there's a lot of stigma around periods and about talking about them and seeking out help. And so it's important for students to know like what is normal, what is not normal, and feeling comfortable to reach out to a healthcare provider, regardless of their gender identity and who they are and what symptoms that they're experiencing to reach out for help. And so, thank you so much for talking with us today and uh, advocating for healthcare and to support teenagers and all people with periods. And so I just wanted to share that we have other events this week for our Menstrual Equity Awareness Week. And so we have another event tomorrow with a Zoom panel. So we're going to be talking more about menstrual equity advocacy and about menstrual equity legislation and how people can support within their local communities to advance menstrual equity and to end period poverty in Illinois. So we're going to have advocates from Northwestern's menstrual equity activists. We're also going to have Representative Barbara Hernandez on this panel alongside a representative from a local nonprofit organization so that they can teach students how to get involved in local community work. And so this week is just so students can learn how to become active members to advocate for menstrual equity and also dispel these myths and have students be more confident in talking about periods because it's just a part of healthcare. And
Mhm.
so I wanted to thank you again for spending your time with us today. And if there's anything else you'd like to end with, this is the end of the interview.
Thank you. It was my pleasure being able to have this conversation.
Thank you so much.